Hello, we are live. We are live. Welcome. I'd ask all the people on this live stream to mute their microphones. Please mute your microphones. Thank you. Thank you. Welcome to today's discussion. Welcome to today's discussion. We are going to be talking about COVID-19 and disabilities. We all understand the difficulties that surround this current time, the difficulties that surround this current period in the world, really. And nobody has really been able to have a conversation centered around what persons with disabilities may be going through. So things like gender-based violence, things like the economic impacts, things like children living with disabilities. There's a whole host of issues that will be discussed over this 2-day period of discussions. And I'm joined by a very vibrant, very connected, very collected panel today. We will be discussing these issues one by one, ultimately to build a discourse that matters. Allow me to play you a short montage of our panel today, even as we prepare to introduce them. Thank you so much. I'm told like I couldn't be heard the first time I was talking, but today I had given a brief introduction on the issues that we're going to be talking about today. We have with us a very collected panel. Some of them, of course, will be joining us in a few seconds. We have Maria Omare.
Maria Omare is the founder and executive director of Action Foundation. She will be helping us talk about her work. We will have a calculated and in-depth experience infused into the discussion. We also have Dan Matakayia. Dan Matakayia is the founder of Dan Shishie Foundation. He is also a police officer. We will also have Mrs. Rhoda Marangu. Rhoda Marangu is an educationist and a psychologist. We also have Julius Mbura. Julius Mbura is an artist. He is also a lawyer working with Letangule and company advocates. Helping me to moderate this discussion is Atieno. Atieno is an artist. She is the founder of the Report. She is also a lawyer and an advocate. Myself, my name is Veronicah Neema. I am a spoken word artist. I am a creative art consultant. And we thank you for joining us during this discussion, even as we delve into it a bit deeper. I will go straight into the introduction of the people who are making this possible. We have Veronicah Neema. the lady doing our interpretation, our sign language interpretation. I think she will just wave after she finishes saying what I'm saying. Okay, Veronica just wave. Okay, awesome. We have also the benefactors of this conversation, the people making it possible through time and resource. That's Peace Tree Network, represented by my colleague and friend, Rachel Stefan. Rachel Will. Okay, awesome. I want us to go straight into the questions, and I will be asking. I will start with you, Maria. Please tell us what you do and how today's discussion is tied to your work and your personal experience. Maria.
Thank you, Robin. Thank you, Peace Tree Network, for this opportunity. I am Maria Omare, the founder and team leader of the Action Foundation, also known as Mama Taf. My colleagues and our community refers to me as Mama Taf. So the Action Foundation exists to build inclusive and resilient communities where children and young people with disabilities can thrive. We have been in operation for 10 years now. We turned 10 in December. And we work with children, women, and girls who have a disability from underserved communities, currently working in informal settlements in Nairobi, Kibera, Mathare, Mukuru, and Kawangware. We also have some programming in other parts of the country, specifically the coastal region as well as the Rift region. And we hope to continue expanding our work. So this discussion is very close to my heart because of since we had the first case of COVID announced here in Kenya, we've been able to experience quite a number of things and hear feedback from our beneficiaries, see the different things they've been able to navigate around because of the issue of COVID-19. Specifically issues of the children, issues of learning, GBV, as well as mental health. So this is right up our alley as a foundation, and we are excited to be part of this conversation. Thank you.
Great. Thank you so much, Maria Omare. I would like now to have Rhoda. Rhoda, please tell us about your organization and how you are tied to today's discussion based on your work. Rhoda.
Thank you, Robin, for giving me this chance. My name is Rhoda Marango, as you've heard, and I'm an educationist. For many years, I've been teaching in high school and even at university level. And what I can say about this has come at a very timely period when the whole world is fighting against COVID-19. And as psychologists, I can just give you a brief history of where I've come from. This dates back to the time when I was employed as a teacher. Way back in the late 90s, many of you are not born then, I believe so. Or if you are there, you are very young. That's when I started teaching. And when I started teaching, the first assignment I was given is that of counseling the students. I was given a class, and later I was incorporated in the committee of counselors in the school. So for a long time, I've been doing the work of a counselor. I've been assisting people who have come to me having different issues, especially the students at high school and even at the university level. That's where I've been teaching for the last 3 years. That is at the university level. But currently, I'm planning on getting an exit so that I can do something that it will be more helpful, especially to the community. I want to open up a center whereby I'll be doing counseling, and I think this is going to assist many more people. At the community level, still I'm doing in a certain rangers organization. I'm working with the teenagers and the youths, especially trying to build what their mental health, especially at this period of time when everyone is fighting against coronavirus. So basically, this is an area that is at my heart, and I really cherish having this time with you so that we can discuss more on what we can do for children with disabilities. That's another area because I also have a child who has a disability, a child whom I really take care of, and I also support the school where she goes to, and even the parents that have taken their children to that school. So basically, this is an area that is very close to my heart, and I believe we are going to have a very fruitful session. Thank you. Back to Robin. Sorry,
Thank you
we
so
cannot.
much. Thank you so much, Rhoda. I'd like to invite Dan Matakayia. I can see he has left the stream. He's going to be joining again in a few minutes. I'd like to invite Julius. I don't know if Julius, you are now able to speak to us. Okay. Julius, can you hear me? Okay. Even as we wait for a few of the technical hitches to be sorted out, I will jump straight into the first question. I'm seeing Dan has joined. I'd like to, before we go to Dan, I'd like to release my colleague Rachel from Peace Tree. Before we go into talking to Dan Matakayia, please, Rachel.
Hello, everyone.
Hello.
Hello.
Hello, how are you doing? Can you hear me?
Good.
Yes, we can.
I am
Yes.
so
Yes.
honored and humbled to be sharing this space with Rhoda, with Marie, with Veronica, with Dan. I am really, really grateful. So, my name is Rachel Stephanie Akimi. I work under Peace Tree Network as the program assistant. With the ability of my very able colleagues, we've been able to have this conversation. Well, just a little bit on History Network. It's an organization that has been around for some time, since 2000, working under the areas of peace building and conflict resolution, under various thematic areas: human rights, research and advocacy, gender and development. And our key focus for COVID-19 and disability falls under our gender and development docket. So I just want to say I am really, really grateful to have you guys on board. And I shall not say much because I believe we will learn more from you. So thank you so much for this opportunity. And I would like to let Robin and Atieno take over the session. So I feel very welcomed. I pray you guys have an amazing session today. Yes. Thank you so much.
Great. Thank you so much. Thank you so much, Rachel. Dan Matakayia. Dan, how are you? Dan, can you hear me? Dan. Okay. Dan left us. Okay. So I want us to jump right into the actual discussion for today, even as everybody else is being assisted to join back in. I want to ask Madam Maria Omare, what are persons with disabilities, and what's the most appropriate term in terms of persons first terminology? What is the appropriate way of referring to persons with disabilities? Please, Maria.
Thank you, Robin. There has been a lot of debate on the appropriate term for referring to persons with disabilities, not just in Kenya, but globally. And we have found that different countries use specific terminology. There have been those who prefer to use the term special needs, those who prefer to use the term differently abled, disabled, person with disability. As an organization, we refer to our groups and our community as people living with disabilities or persons with disabilities, children with disabilities. But what I'd say is that when it comes to terminologies, it's the best approach would be to refer to someone in the way in which they're comfortable with. If a parent is comfortable with referring to her child or his child as a special needs child, I believe it's respectful and the right approach to refer to them according to what they're comfortable with. And there are those who are happy being referred to as disabled people. So I don't think anyone has I'd say the mandate or the authority to label anyone in any way, but we should, as communities, we should refer to people in the where they're at and in the way at which they're comfortable with, without having our preconceived notions of what we think they should be referred to as. So that's my take on it, Robin.
Thank you so much, Maria. I'd like to ask Rhoda, Mrs. Rhoda, please tell us. You know, you work as a psychologist, and you are in the education field, and you have had a wide depth of experience with persons living with disabilities. Please tell us, are there any things that people living with persons living with disabilities are currently going through that you feel everyone should be able to know about? Is there a misinformation? Is there something that you feel is really pressing that you need, everybody who is alive needs to know about? Marango.
Thank you, Robin, for this chance again. Yes, you've asked me to say whether there are some things which people are going through currently that everyone should know, especially those people living with a disability. As Maria has just said, we have all those terminologies that we use in reference to those people who have a special need. And as she has said, we can use all those terms in reference to those people based on how comfortable that person is. One thing that I would say about what is happening today is that these people are going through a lot. Some of them are not able to express themselves, and you'll find that there are many issues that are overlooked. In some cases, I mean, that these people seem to be quite voiceless. And therefore, as a society, we need to come up and speak up for them. You'll find that there are many things that we are going through, especially at this time, things to do with what the government has set in place as we fight against the COVID-19. These people are not able sometimes to access to the right information, maybe because the mode of communication may not be the suitable one for them. There are those who cannot hear, or the hand of hearing group. There are those who cannot see, and the mask prevents them from knowing exactly what whoever is communicating wants to pass to them. So you'll find that this is an area where these people are really going through a lot. They may not be able to get the right information because of that hindrance. And you'll find that apart from that, the social distancing measures whereby people are urged to keep away from other people to maintain that distance of 1.5 meters puts these people at a great risk sometimes, because you find that there are those who cannot be able to support themselves. They will require people who can help them. Take, for example, those people who are on a wheelchair. You find that they cannot be able to go through their daily lives without assistance from other people. How do they assist themselves if they are going to keep away from other people in order to keep to the measures of containment? So you find that that's an area that is really affecting these people. They cannot be able to access the transport means, maybe those that are not able to afford private means. They have to use daily transport means like the matatus, which are chaotic sometimes. They may not be having that assistance of getting to the vehicles without getting closer to the people. And you find one of the modes of communicating or transmitting the disease is through that closeness. So you find these people are really affected at this time. The other thing that you find is that these people, especially those that are in homes, who rely on community to support them, sometimes may not be having that support system, because the support system that comes from the neighborhood sometimes may not adhere to the measures of containment. These are people who are moving in and out of the homes. You do not know where they or who they interact with once they get out there. And it's a risk when they come back to their homes and offer any kind of assistance to these people. You find that these people, the people living with disabilities, may need to be fed, they may need to be assisted in their daily living activities, like even bathing and even taking up other activities. And therefore, that lack of support service hinders them very much, especially at this period of time. There is a lot of discrimination also. I remember one parent telling me how she was taking a child to a center where she was to go for a occupational therapy. And you find, because there is that feeling among the people that those people with disabilities sometimes have the disease. They have bad diseases like COVID-19. You find that every person in that vehicle decided to unbond the matatu because they feel that this woman is coming with this child who has a disability, and there is that likelihood that this child is going to pass on the disease to the rest of the people in the vehicle. So you find that it is very traumatizing to the people living with disabilities, and therefore I think there is need to think about more on what can be done in order to assist them. There are also those that are taking their education, especially at this time when the schools are shut down. You find that some children who are perceived to be normal and in quotes, you find that they are able to access the amount of uh, uh, the transmission of education. They can be able to access the what we call Zoom and other means of getting the amount of education. But for these people with special needs, sometimes they are left out. You find that they are not able to access education. They do not have teachers who are very well trained, maybe to pass on the information in the right way. And therefore, you find that as a result, they are left out, they are left behind compared to the other children who may be at their level. They are also not able to access the disability fund. You find at time like this, the government has set up a fund for the vulnerable groups of people in our society. But when we talk about vulnerability, the government has not specified that this is the fund set aside for the disabled group of people in our community. And as a result, you find that they are not able to access many of the things that they are expecting to access from the money issued out by the government. They cannot access good medical care. They cannot even have enough for their food and even to cater for their other basic needs. So basically, you find that these are people who are facing a lot of problems during this COVID-19 pandemic. You find also that they are going through a lot of brutality. We heard of some cases where some of them were even, one of them in fact was killed because he could not express himself when he was confronted by the security men, police. So in the course of trying to express himself, the police could not understand him, and therefore he ended up being killed. There are many other things that are happening, the sexual exploitation and abuse, and many other evils that are affecting these people. Thank you, Robin.
Thank you so much. Thank you so much, Rhoda. I'd like to, I see a great deal of the things being highlighted by Rhoda centered around the question of access, so access of services, access to information, access to amenities, basic human dignity and rights. I'd like to add a layer to the question and throw it at Maria Omare. Maria, based on your experience at the helm of Action Foundation, how could you attach the realities that Rhoda has told us about to the ground, to the everyday activities that you engage in, Maria?
Thank you, Robin. So I'd like to, I agree with a lot of what Rhoda has said. I'd like to comment on the issue of speaking up for those who have a disability. As a foundation, we believe in empowerment, and we believe that no one is voiceless. You only become voiceless when your power is taken away or when your environment is disabling you in one reason or another. And a disability only becomes a disability without the community supports and access, as you have discussed. So we believe in, across all our beneficiaries, giving them space and supporting them to be their full self and to reach their full potential and to speak in their own authentic voice, than having us as the staff or as the people who work with us speaking for our beneficiaries. So on to your question about how our work ties to what the different issues that have been raised. We have seen since COVID started, issues of learning, issues of access to learning. There have been a lot of interventions that aim at providing access to learning for all learners across the country. And we have found that children who have a disability have been largely left behind, particularly in the free-to-air stations. Although I have to applaud efforts that have happened within the disability space here in Kenya, a network we are part of called Action for Children with Disabilities have gone out of their way to create learning materials through the Edu Channel platform. There's a time slot for learning content for learners who have a disability. So I applaud those efforts, but they have been largely left behind. What we have done as a foundation is we are seeing how to support learning at home for our children who have a disability. And the model which you have used is supporting parents to have the materials for learning so that they can be able to interact with their children. And that has also been challenging because of different factors like unavailability of parents and also attitudes about parents towards their learners, particularly those who have multiple and severe disabilities. But through our network of teachers, we've been seeing how we can continue to support learning at home for those who have a disability, in addition to providing the materials. When it comes to learning as well, reaching out to all learners, not just within our programs, our mobile-based application called Somesha, which is available on Android and it's free, has been able to provide learning content, particularly for early years learners, to encourage storytelling, to encourage parents to spend time with their children. And this content is available in accessible formats. We have those in sign language, we have audio books, we have visual books. So that is part of what we have tried to do. But we can't still say that, particularly for the rural child who has a disability, they're even more disadvantaged than an urban child who has a disability, particularly in the interventions that currently exist. We work in 3 major program areas: in health and well-being, inclusive education, and women and girl empowerment. For our children who are in our health and well-being program, access to therapy has really been challenging. From when COVID began, we had to close our facility, and across other organizations that work with children with disability, particularly in provision of therapy services, a lot of them, when COVID hit, had to close. So for quite a number of months, children with disabilities did not access therapy services. And from the groups that we are in and the conversations we've had as different organizations, we've had several cases of regression. And in some instances, a few children have even lost their lives because of lack of access to medication that they were receiving at health facility, access to the actual therapy that supports them to be able to go on in their day-to-day lives. So that has been quite unfortunate. But what other organizations, together with Action Foundation, have done is we formed a group which had a meeting with the Ministry of Health to see how we can come up with guidelines for safe resumption of therapy services across the country. And that conversation is still continuing. And besides that, we have seen some of our people within the network we are part of resuming with therapy while adhering to the guidelines. But that has meant that they're only seeing 3 children in a week. Well, previously they were seeing 10 or 20 in a week. So children are still being left behind. And we're looking to see how we can support that through continuing to encourage support from the Ministry of Health and also access to things such as personal protective equipment that are necessary for the resumption of therapy services. Issues of gender-based violence have really been real for us as a foundation. Children and girls and women in our Women and Girl Empowerment Program have reported instances of violence within their households, and intimate partner violence has really been on the rise. Because with COVID, it has brought about higher levels of stress at household level, which means that the head of the household, mostly who are men in our communities, have had higher levels of stress to deal with. And we've seen that has led to higher cases of intimate partner violence, particularly as a way of coping with the mental health that surrounds this time that you're in of COVID-19. Access to sanitary supplies and sanitary pads has also been a challenge. We were fortunate enough to get some support to distribute sanitary pads across our beneficiaries and also with other organizations here in Nairobi, reaching close to 400 women and girls. And we saw that access to pads for particularly girls with intellectual and physical disabilities was quite a challenge previously, even before COVID. So that is something that more stakeholders and organizations need to come together to address. And there was one particular household where we visited. We were supplying 4 months of sanitary pads and hygiene materials. And the girl actually broke down in tears, and she said that she has never had sanitary pads in her entire life. She was used to using, because the family has more pressing needs for food, for other needs that the household has, that sanitary pads are really not a priority. So there is need to see how other organizations can work with us or work to ensure that girls who have a disability also get access to menstrual hygiene supplies. Mental health has also been a great challenge, and that has been resounding across all the women and girls that we support in Kibera as well as in Kawangware. Mental health at this time has really been challenging. You are away from your friends. You're previously in school, had a social community that you're part of, but now you're locked up at home. You're unable to venture out and interact with others. Your family is stressed. So there has been a rise in mental health problems across our beneficiaries, and we're looking to see how we can support that. And as a foundation, we are currently offering free counseling services at our facility in Kibera. Yes,
Okay.
Thank you, Robin.
Maria, you have given a very broad inquest on the question I had asked.
Yes.
But we're going to also delve a lot into the things that you have already stated. I want to throw it back and forth between yourself and Rhoda, even as we wait for our other panelists to have the technical difficulties they're experiencing get sorted out, because I believe they will add a lot of context and experience to the conversation. Now, Rhoda, you had mentioned a while back in your responses about the sexual exploitation. I want to ask both of you, and I'll start with you, Rhoda. The prevalence of gender-based violence in this time of the pandemic has been on the rise. In fact, some campaigns even call it the shadow pandemic, because it's a pandemic that's growing because of now COVID-19. And already the way the situation is when everything is normal is stretched out and is not a desirable kind of environment when it comes to sexual and gender-based violence. I'd like to ask, from engaging with persons living with disabilities during this period, how much more has gender-based violence been prevalent among them due to the pandemic? Rhoda.
Thank you, Robin. As you have seen, gender-based violence is very prevalent, especially at this period of time. There is this data which shows that about 45% of women and girls aged between 15 years and 49 years, have experienced some form of violence, may it be physical and other forms of violence. And out of these, 14% of these women and girls have experienced sexual exploitation. You'll find that this is something that is very rampant, especially at this period of time, where people are restricted in their homes, there are no movements, and you find that those people living with disabilities sometimes are not able to defend themselves against the perpetrators. You find that when they are left at home unattended, maybe because the parent has, let's talk about the girl now, maybe the parent is going out to get food and leaves this girl child under the care of other family members or even neighbors. There are those people who may decide to take advantage of this girl who is not able to fight for herself. The child who is not able or does not know what it means to be sexually abused. The child who does not know how to fight for her rights. And therefore you find there are those people who have taken that chance to violate these girls sexually. I remember a case where a mother the girl got very close to one of the neighbors. They go to the same church and they are very close. Someone who is not a stranger to the family. And this person now was left to take care of this girl as the mother went out looking for food. And in the course of the day, this neighbor, a young man, ran the girl into his house. And he did it. He just had sexual contact with a girl who could not be able to tell exactly what happened. And when the mother came back now, you find that she had to tell the mother what happened without knowing that it was in some kind of abuse. And you find this something that is not acceptable. And girls and women need to be taken proper care of. The society needs to be enlightened on what ought to be done, especially when it comes to sexual violations of the rights of those girls and women. And you find the people living with disabilities are not left out. They should also be taken care of. The society needs to enlighten the members on their expectations, the rights of each person, regardless of whether they are living with a disability or whether they are living without a disability. So you find this is one area that has been really affected during this period of the pandemic, and therefore something ought to be done in relation to this. There's when this mother now, let me just go back to that story. When the mother to this girl decided to take an action, you find that there are some restrictions that were posed by the family of this young man. Kindly do not go further exposing this man to the police and to the authorities. Let's sort it out. So you find this is something that is happening, and the society sometimes is crossing their mouth. People are closing their mouth and not speaking up, especially when it comes to this. So basically, you find that sexual violation of girls and women during this COVID-19 pandemic has been on the higher rise in the society. Thank you, Robin.
Great. Thank you so much, Rhoda. Dan Matakayia. Dan, can you hear me now? Yes, Dan.
Where?
Dan, can you hear me?
Yes, can you see me?
Yes, we can see you and we can hear you.
Okay, thank you so much.
Dan, I want to...
I'm sorry for the technical hitches.
It is fine.
That I've
It is
been
fine.
experiencing. Yeah.
Technology is sometimes it beats the best of us.
Yes.
Yeah. I want to really bring you into the discussion already because I feel like we are at a point where you can enable us to get a lot of clarity. Rhoda was handling a question on sexual and gender-based violence. I know a bit about your story.
Yeah.
I wanted to throw the question your way so that you can give us your own understanding from your experience with Dan Shishe Foundation. Please tell us, how much has gender-based violence been prevalent among persons living with disabilities due to COVID-19, and also give us a few nuggets of knowledge that you feel we should know about the question of sexual and gender-based violence? Over to you, Dan.
Okay, thank you so much, Mr. Robin.
Yes.
I know you have done your introduction. Let me talk briefly about myself. Because for those who don't know me, my name is Dan Matakayia. I'm a police officer and I'm visually impaired. So I'm one of those people living with disability. Yeah, I'm the founder of the Anshisha Foundation, an organization whereby we are championing for the rights of men and boy child in regard to gender-based violence. The issue of violence within our society is so rampant, as I can say, and
Okay, we seem to have lost Dan. I am sure he will join us in a few minutes. But meanwhile, I'd like to toss the question back to Maria. Maria, the question was, how much more has GBV been prevalent among persons living with disabilities? If you could help us contextualize. Dan is back.
Okay.
Dan.
Okay, sorry, I'm still experiencing the same problem. But
no worries.
Yeah. So as I was saying, the issue of GBV, gender-based violence, is so rampant during this time of COVID-19 in our society, and persons living with disability are also victims of gender-based violence. And as we know, one thing that is really affecting these individuals is that the first thing you need to understand is that these people are so vulnerable, whereby even accessing justice is becoming a problem because of their vulnerability. The institutions which need to take care of these individuals, you need to do the investigation and to help these people does not give or proper support. I can tell you that when these individuals goes to the, maybe let's say that
Dan is experiencing a lot of difficulties. Allow us to sort that out. But then, Maria, before I go to the next question, even as we wait for Dan, do you have anything to add based on your experience working with the people you work with in your community of persons living with disabilities that you feel you need to help us contextualize the discussion with, Maria?
Thank you, Robin. Yes, in cases of gender-based violence have really been on the rise, especially in our communities. That is the low-income communities that we support, or what some would call informal settlements or slums. And we find that the reason behind that, beyond the COVID period, gender-based violence mostly occurs because of deep-rooted cultural and religious beliefs, particularly about women and girls who have a disability, and also about the power dynamics that are at play, where women with disabilities may be considered to be, into brackets, an easy target. But also we've seen in the discussions we've had with our women and girls that there are some weird myths out there that perhaps when you engage with a woman who has a disability, it can cure you of HIV and AIDS, or women with disabilities are considered to be asexual. So, so they're considered not to be that sexually active. So some may consider that when I have sex with a woman who has a disability, I have less likelihood of contracting HIV and AIDS. So a lot of social myths, stigma, and cultural beliefs perpetuate the cases of violence against women and girls with disabilities. And when we talk about GBV, in as much as you're talking about the instances of these cases happening, there should be even more conversations about prevention and about raising awareness about it in a way that is respectful for the women and girls. And we ensure that the messaging of GBV do not reinforce that stigma and discrimination, particularly when you're talking about women and girls with disabilities. So our take is, for organizations that are raising awareness about women and girls with disabilities, we should put these women and girls at the core or at the forefront of giving advice or giving direction as to how these issues need to be addressed, so that we are truly representing their interests and we're ensuring that our messaging are respectful and do not continue to reinforce that stigma and discrimination. We should also encourage safe channels of getting support post instances of gender-based violence, where we can create safe spaces where those who have experienced gender-based violence and have a disability can be identified and can be referred for support, and can openly come out and say that I have gone through XYZ and how can I seek support because of the issue that I'm experiencing. Let us not continue to silence these issues in our communities. Thank you, Peace Tree Network, for creating this platform. This is part of that. And we also want to ensure that as organizations and communities, how can we protect our women and girls who have a disability? And what structures can we put in place to ensure that we're not only reacting to the cases happening, but you're also protecting and preventing these cases from happening? So that's how I'd take it.
Great. Thank you so much, Maria, for the contribution. I'd like to go into. I'm seeing a lot of the things we're talking about are touching on cultural. There's an understanding of culture and religious beliefs that plays a huge role in how our society is shaped. From how we do the things we do, what we think is normal, what we think is against the norm. Our culture and our religious beliefs have a lot to play with the interplay and the tapestry of these issues. I want to ask both Maria and Rhoda, do you think cultural and religious beliefs play a role in worsening the situation currently? And how do we address this? So begin by telling us the cultural and religious beliefs that you think help to make the situation that much worse, and how you feel we should take as an approach to remedy these cultural and religious beliefs that are making the situation more stochastic. I'll throw that to you, Rhoda.
Thank you. Well, the culture and religion play a very big role in worsening the situation when it comes to gender-based violence. You'll find that our cultures, especially our African culture, if not stemmed, can really lead to something that is very detrimental to the mental health of women and girls when it comes to the violation of their rights. you'll find that the culture has those stereotypes. Sometimes whereby someone feels that women are only there to be seen and not to be heard. And therefore, as a result of that, you'll find that there are some things that are likely to be done to these women and expecting them not to speak against them. You'll find that women are forced into early marriages by their parents based on our cultures in some instances. And when such women are forced into those early marriages, those girls definitely will find that they go through a lot in that marriage. The place of women in many cases is taken to be the kitchen in some communities. What does this mean? Does it mean this woman should not be actively involved in other economic activities that can benefit the society? In some cases, you find that when this woman decides now it is time for me to venture out and maybe improve my economic status, maybe by maybe getting a well-paying or a paying job, this woman may be shut down by the man that this is not your place. You ought to be back at home. I'm going to provide for everything that you need. And therefore, you find that that woman is economically not empowered. And as a result, you'll find that such a woman may not be very productive to the family and even to the society at large. The religion also plays a role in the gender-based violence. You find that sometimes there are those verses or quotes from the religious texts that some people turn to. For example, you find that there is that story in the Bible where we find a woman who was stoned, who people wanted to stone. She was not actually stoned, but people wanted to turn to her and stone her because they felt that she was involved in an immoral activity. So you find that there are some people who may decide to quote such verses, trying to justify why they are violating the rights of women, saying that even the Bible supports it. And besides that, you find that sometimes when these people are violated and maybe they decide to go to the religious people like the clergy still may try to get some verses from the religious books like the Bible, maybe where they are told just forgive and forget and move on. So you find that such things are happening. The religion, the culture are not in some ways supporting. However, we cannot just say that that is what is happening completely without going back to some of the other things that we find that is still related to culture and religion in relation to solving some of these issues. You find that we have some very good scriptures that support the rights and the freedoms of women in the society. And therefore, when it comes to religion, the religious people, like the clergy, ought to be enlightened more on what is expected of women in the society and their rights and how to defend them. They should be in a position of assisting them whenever they are facing difficulties in life, trying to show them where they should go for assistance, trying to guide them, maybe report to the police, go to the hospital, and if they find they are not able to cope completely, if it is in a marriage, they should also be in a position of telling them when to quit. So basically, you find that to avoid the gender-based violence and things to do with the culture and religion, there needs to be something done in relation to that understanding on when one should quit. If it is a girl, we should also have safe homes where girls can be taken if they are not of age, so that they can be assisted in going on with their education and even get employment and assist themselves and the society through that way. Back to Robin. Thank you.
Thank you so much, Rhoda. I want us to, I don't know if Maria has anything to add.
Just to add a bit, some of our cultural and religious beliefs are truly deeply rooted in patriarchy, where we emphasize on male dominance. It's the male who should be a certain way. It's the male who should be in charge of the household. It's the male who should be the provider, so really emphasizing on male dominance. And the thing about COVID-19, which is our discussion for the day, is that it has challenged that, where a lot of our males have lost their jobs. A lot of our males are now unable to provide for their families. And because the issue of COVID-19 has challenged that, it means that there are extremely high levels of stress in their household, where now the male in the home looks at different ways at which to still exert authority and power in their household. And a lot of times this is demonstrated as violence, where they are going to engage in being extremely violent towards their wives as a way of them also bridging that gap because of how they're feeling because of having lost their jobs. But thinking about male involvement on males in the prevention of gender-based violence, we believe that men such as Robin here should be champions to help in prevention of gender-based violence. I think that women alone or girls alone cannot work to end GBV in the world if we work as an island, and if we say this is our thing, we are going to do it on our own. It's extremely important that we engage men, and more men are brought to the table and are brought on board as champions to work against preventing violence against women and girls with disabilities. At the Action Foundation, we have male champions across all the villages that we work in Kibera. We are doing a project in Kibera that is supported by Women Strong International towards prevention of violence against women and girls with disabilities. And we've seen amazing male champions talk to their peers, talk to other men, even getting to the point of going to where they meet, to talk about these issues, because we think that we cannot leave men out of these conversations, and we should promote positive male masculinity. We should support male to come on board as champions in our efforts. Yes. Tufanye na wanaume kazi na wanaume ili tukomeshe dhuluma. Kiswahili ilitoka na meli, but we end violence against women and girls with disabilities.
Thank you so much. I'm seeing Julius. Julius, are you with us in the stream? Julius? Julius, can you hear me? Okay. So, still there's a bit of Julius. Hi, Julius. Julius. Okay. I don't think he can hear us. That's getting dealt with a few. I want to invite my co-moderator Atieno to take us through the comments. There has been a live panel of comments even before we tie down the conversation with the last few questions. So I'll invite Atieno to give us her take and also guide us through. Atieno.
Hello. Can you hear me?
Yes, we can hear you.
Okay, so you will forgive my camera. It looks like I'm in the deep Ushago, but I trust you can hear me. So I'm glad to be here and having listened to the conversations that are going on. And before I ask any follow-up questions from the discussions we've had, I'm just going to go through some of the comments that have come in throughout this conversation. And I'll go through those who are saying they're with us. We have Karanja Wangoi saying to Kondani. We have Willie Oeba, awesome conversation. We have Evans Quez Ndivagu saying we are in. We also have Fundi Nyata saying an amazing conversation this is. So let me go to the first question that was asked by Karanja Wangoi. And it's also a similar question by Tunho. I believe those are the same persons. So he asks, is there any chance that a student can get, if they get injured mikono after registering exam as people without disabilities? I believe what he's trying to ask is whether a student who did not register as a person with disabilities can still get a chance if they get injured before they're able to change that status. Maybe I can ask Rhoda to contribute on this question.
Well, the question may not be very clear on what this Karanja wants to know. Let me just repeat the question. Is there any chance that a student can get, if they get injured after registering exam as people without disabilities?
Maybe to help out a little bit, let me first ask, do people with disabilities, students, when they're registering for exam, is there a place where they indicate that I am a person with disability as they are registering?
Yes, because you'll find that for one to be taken as a person living with a disability, that person must have gone through the normal assessment. They assess, and the type of disability is determined. Whether this person is physically disabled, whether this person is virtually disabled, deaf, or any other form of disability. So if one registered before they were injured, definitely it means that that person will be registered as a person without a disability. I think that answers the question. That person is registered as a person without a disability.
Yes. And so I think then he's asking, so if they're registered as people without disabilities and they get injured afterwards, what happens to them? Do they have a chance to go back and register as people with disabilities, or what happens to them?
Yes, one can register, because we find that disability is not only determined by birth. There are people who are born with disabilities. There are people who acquire some form of disability after birth. This can be through an accident or many other things that happen. So you'll find that when this person now gets some form of a disability, that person is eligible. That person can register and can register and can qualify to be termed as a person with a disability, with all the benefits that such people have wanted from our government. Thank you.
Thank you. Thank you so much, Rhoda. I think that answers the question. If I look at the chat, there is no any other question. There's just a comment by Winnie Jerry, who says, anyone who would like to network to support persons with disabilities in Nyeri County, link up with me on Facebook. I'm Jerry Modoni. So excited to be here. Thank you, Jerry. And I hope anyone who would like to link up with Jerry can do so. So maybe just to ask a follow-up question that came up while we were having this discussion. Maria, you mentioned about therapy sessions that are given to children, and you also mentioned that during this COVID-19 period, children have not been able to access these therapy sessions, and there are some who have lost their lives. So I got curious and wondered, what do these therapy sessions entail? How do they look like? And how important is it for, children with disabilities to access this kind of sessions?
Thank you, Atieno. Provision of therapy in our programming falls under early intervention. And when you talk about therapy, you're specifically referring to occupational therapy, physiotherapy. Some may require speech and language therapy. For children who have multiple and severe disabilities and those who may be experiencing convulsions because of their disability, therapy is one way to help them cope with that. So during this time of COVID, because of not receiving therapy, a lot of children have actually regressed. That means that if before they were now able to hold their neck up or sit upright, because of not receiving therapy for a period of time, because therapy has to be consistent, and therapy has to be done in a way in a way to support the child to be able to adapt and carry out the activities of daily living. So not receiving therapy for a lot of children has not only led to regression, but those in which therapy was supporting in the prevention of convulsions and to help them to be able to cope. Not receiving therapy has been quite detrimental. And children with disabilities, talking to my little ones, I call them my little ones. I have a daughter, but I have more than 500 kids that I call my little ones. Not receiving therapy, like going for therapy, mostly it's twice a week for most of them. They form a form of routine. They know that every Tuesday and Thursday I go to a certain place. I meet, for example, Dr. So-and-so or this therapist. So when the therapy services was suddenly came to our house, it meant that routine was disrupted, which was quite chaotic for a lot of the children, because especially for those who have autism spectrum disorder and others, that routine was totally disrupted. And a lot of these therapy spaces were also being relied on for food and medication. And medication for convulsions is very, very costly. And a lot of low-income families cannot afford. So now that they're not receiving medication and they're not receiving therapy, in a group we're in called COVID-19 and Disability, we've had some of the stakeholders or therapy facilities talk about their children, one or two kids who have actually lost their lives, which is quite unfortunate. So not being able to get therapy is really, really is actually denying a child, I'd say, even their human rights, So it's something that we really need to work towards as people who are providing therapy services. I know some have resumed operations and we're in the process of also reopening in October while adhering to the government guidelines.
Yeah, thank you. Thank you so much for that, Maria. Maybe I can ask one more follow-up question to Rhoda. When we're talking about, what persons with disabilities go through on a daily basis, and even during this time of COVID, and how, their situation has spiked to the negative. What is the role of well-abled people in this conversation? How are you involving people who do not have disabilities or people who do not understand, what persons with disabilities go through? How are they involved in ensuring that persons with disabilities are treated with the dignity that they deserve? I think your mic is muted, Rhoda. Rhoda, please unmute your mic.
Sorry for that. Yes, we are saying that these people have gone through a lot of issues during the COVID-19, and the society needs to do something about it. You have asked something to do with the people that we refer to as normal, in quotes. These are people who are able to make their own decisions, and you'll find that we need to get solutions for all the problems that these people are going through. For example, you'll find that when it comes to the area of information, there needs to be a way out whereby we have maybe the sign language interpreters like the one that we have today, Veronicah Neema. That's very good of you. That's one area that can be catered for. We have the sign language interpreters. We can use even plain language or language that can easily be understood by people who are living with disabilities in order to maximize their understanding. We can also provide protective, a way of protecting their mental well-being by ensuring that these people are spoken to, we are very close to them, we take the initiative of ensuring that their health is taken care of, protecting them by giving them the right kind of food, shelter, and the entire social support should be good in order to assist these people cope with COVID-19. And even the government also should do something to ensure that these people, people's welfare is taken care of. They can give out the funds specifically for people who are living with disabilities to ensure that their well-being is taken care of, ensure that they are supported in all ways so that they can be able to cope and to come out stronger than they are now. Thank you.
Thank you so much, Rhoda. I don't know if Maria, yes. I don't know if you have anything to say, Maria, or add on to that.
Yeah, so what is the role of people who do not have disabilities? I believe like disability, as you all say, it's a community that anyone can be part of at any time of their life. So it's not an exclusive club. All of us can be members in one way or another. But in the spirit of inclusion, each and every one of us has a role to play to ensure that those who have a disability around us are supported and are included and feel part and parcel of the community. So, and I think that inclusion starts early. Let's not wait for children to be 18, 19, 20 for us to realize, oh my goodness, now we need to see how my teen son who has a disability can now be part of their peers. So inclusion should start early, right from Sunday school, preschool. We advocate for inclusive education right from early childhood education. We believe that each and every space in our society should be inclusive, and it's in the little things such as, first of all, inviting, like ensuring that they are invited to. We invite our community members or our persons who have a disability to our events, to our functions, and that we ensure that the environment in our schools, in our churches, are inclusive for persons with disabilities, such as by putting up ramps, church services to include sign language interpretation. So it is the small accommodations that help people who have a disability to be included in the community. So we can all do our little thing to ensure that our Kenya is truly inclusive for all, with and without disability. And the beauty about being accommodating everyone is that it benefits all. When you put up a ramp, it will help that woman who's on her third trimester of pregnancy, as well as that person who's using a wheelchair. So being inclusive and putting up those accommodations benefits each and every person in the community, and it absolutely makes our society better. So let's all do our part.
Thank you, Maria. Yeah. Before I throw it back to Robin to carry on with the rest of this conversation. And the practical question to you, Maria, I've been mentioning about sanitary towels and how persons with disabilities without not have access to sanitary towels. How can we chip in, how can people chip in and assist for them to ensure that these ladies have access to sanitary towels?
Hello? Hi, Atieno. Okay. Thank you so much for that session. I lost a few of the past few seconds when Atieno was talking, but I believe a lot had already been touched on. I want to go back to Dan Matakayia. Dan, are you with us? Hello, Dan. Okay. Dan, are you with us? Dan Matakayia. Okay. This is proving to be a difficulty. Dan, if you can hear me. Dan? Okay. So we had finished a great number of the questions that we had for our panel today, but I want to tie down with just a few more questions so that the discussion goes full circle. So Maria Omare had talked about, she had touched on the work she does on mental health. I also know that Mrs. Rhoda Marango is a psychologist, and she has a very in-depth experience when it comes to all issues, mental health and wellness, being in the field. But we still haven't gotten a picture of what the current situation is for persons living with disability when it comes to mental health. We also want to know from our panel what assistance is available and how can we plug in. So I will throw this straight at you, Rhoda. What assistance is available for persons living with disabilities right now? What is the situation for persons living with disabilities in as far as mental health is concerned? And how does me, mtu wa kawaida, or anybody else, how do I jump in and help without having to say, serikali ilifanya, serikali haitafanya? What can I do personally to plug in? Rhoda. Please unmute your mic, Rhoda.
Thank you, Robin. One thing that we find with people living with disabilities and their mental health today is that Many of them are going through a lot of psychological distress. You'll find that the measures that have been spelled out by the Ministry of Health and the government generally sometimes may be very distressing to these people. The idea of social distancing or physical distancing has led to a lot of social isolation, especially where you find people have to keep to their distance. You find that those people with disabilities, those people living with disabilities are really affected. There is that lack of basic needs, lack of medical care, social isolation, loneliness, discrimination, a lot of unemployment because many of them have lost jobs. They cannot access whatever they were able to access before the pandemic struck the world. And as a result, you find that they are going through a lot of financial difficulties. Those people who are supposed to assist them sometimes may not be in a position of assisting them because of the measures that have been put in place. And that leads to a worsening situation when it comes to their mental health. These are people who need a lot of assistance. And we keep on asking ourselves, how do we assist them? To assist these people, they need to know exactly what they are going through. And that can only be done if proper communication is done by disseminating the right information and the correct information, telling them what is expected of them and what the society expects of them, guiding them on what to do, because you find that these are people who need a lot of guidance when it comes to the many things that they are going through. They need to be supported by taking them for, let's say, psychological support, whereby they can be introduced to counselors so that their mental well-being can be taken for. We find that as these people are introduced to the psychologists and counselors, they are able to express themselves. They are able to say what they are going through. And one thing you find about the work of a counselor is that the counselor is not meant to solve the problem for the person, but just to give some kind of direction. So when these people are directed to the right people, they are able to be assisted. They can be directed on how to go about their daily lives without much stress. They can be directed on how to handle themselves, on how to take different things based on what is happening today. They can also be assisted by having a very good support system based that starts from the family, whereby every family takes that initiative of taking care of the people living with disabilities who are living in their households. We also sensitize the community also in helping them by providing for them. Maybe someone does not have the basic needs. That can be done by the other members of the society. There are quite a good number of things that can be done to assist the people living with disabilities during the COVID-19 to come out as better people by ensuring that they are taken care of there physically, economically, and even socially, ensuring that they are not kept or they are not left out to be alone for long periods of time. So basically, you'll find that Those are just a few of the things that can be done to assist these people during this pandemic period. Thank you.
Much, Rhoda. I understand. I really want to engage. Dan, can you hear me?
Yes, I can hear you, Robin.
Okay. We've had a lot of issues with your connection, but
Yeah.
I want you to jump in and give us a few of your insights, because we haven't had the chance to have you enrich the discussion we're having with your knowledge and your experience. So we were talking right now about what can be done to make the lives of persons living with disabilities that much easier, especially when it comes to things like mental health. And you, as a person living with disability, and as a person who also runs an entire foundation that deals with sexual and gender-based violence, how do you feel persons living with disabilities should be helped? Dan.
Oh, thank you so much, Robin. These people, let me tell you, me, when I joined this group 7 years down the line, what happened is that many people ran away from me. All my friends, my colleagues.
Okay, this has got to be the Armageddon of technological failure. but we understand it's really difficult to connect, especially right now when we're doing everything remotely, which brings credence to what we are trying to actually talk about today. I'm seeing Dan is back again. Yeah, this makes this conversation all the more important to have. We've been having Julius online. Julius, I don't know if you can hear me now. Julius, okay. So this goes to show you how much more we really need to have these conversations. Just to take us a bit to a last comment that we've had. Winnie Njeri says, being a person with disability, I'd say the one thing that works is education and empowerment, not help. And let's encourage persons with disabilities to register with the NCPWD. The opportunities it offers to persons with disabilities are endless. I'm seeing Dan Matakayia is back. Let's see if we can get... Yes, Dan.
Okay, I was saying
Yes.
one of the in our society,
Yes.
wanalenga sana this group of people.
Yeah.
I was giving a scenario whereby the time I lost sight, many people ran away from me. So I felt isolated. So I felt rejected. And at that time, I just needed someone to be there for me, to support me. Apart from the family, many people ran away from me. So those are some of the issues these people are facing. People tend to think that whenever we have someone with disability around them, they are liabilities. They don't know these people have great potential in their own way. So what I want to urge members of the public is to support these people, reach out to them, understand what they need, and then offer them some support. Right now, the life of a person with disability is quite expensive, I can tell you. Even accessing information, going to school, and all those things is quite expensive because, like for example, for the people who are visually impaired, getting a braille papers only is one dream is 750 shillings as compared to one dream of the print paper wengine wanatumia. So you find that the print papers are quite expensive. Maybe to write is quite expensive. A braille paper costs 85,000. That's the cheapest, as compared to a book, which you can get it at maybe 50 shillings. So if you compare the life of person with disability, it's quite expensive. But the only thing we can help these people to support, reach out, support, take your time, talk to this individual. Tusiwa-isolate like wakae kama they are abnormal, they are not human beings. They are human beings. They have potential. They can offer something to our society. We need to embrace and support these people. Reach out to them, support them whenever they are calling for support. And then to the issue of the GBV, I know many of them are experiencing violence, but as I was saying, these people are so vulnerable. Even when they have been abused, going to report, they feel that the perpetrator will still come back and abuse them. So they feel they are not comfortable. Some of them wanna suffer because hawana ile support, even within our institutions. The police, I'm a police officer, and I can tell you, we have officers have not been sensitized enough on the issues of person with disability. So hata akienda hapo station anaangaliwa tu like kitu ingine, like not a normal human being. And then for those people with the deaf, within our stations, we don't have like those people who can translate. So akienda hapo, it's not easy even for this individual to make a report. Unaona? So that's a gap within our society, within our station, our police. And I'm happy because when I once raised that issue, the commission, they have taken it up, and many officers are being trained to be translators, maybe to help these individuals. Even in our institution, like hospitals, we still have a problem, and we also urge the government to sensitize even the nurses and the medics so that they can also offer and support this individual, this PWDs. Wakienda hapo wasikae kama like wanaangaliwa ni kama, yani ni kama hao wametoka nchi ingine, dunia ingine. Yeah, they need support. The moment you accommodate this individual, they also feel happy. They feel wanakuwa and wanafurahia maisha pia. Yeah, I think that's what I can say.
Thank you so much. Thank you so much, Dan Matakayia. I want to bring in Julius. Julius, I don't know if you can hear me. Can you hear me now? Julius. Hello, Julius. Okay. Julius cannot hear me. But I don't know if we have Julius?
Yes, yes.
Julius, how are you? Okay. There seems to be a challenge with the audio. Hello, Julius. Julius, can you hear me? You can hear me?
Hello?
Hello, Julius.
Hello.
Julius. Can you hear me, Julius? Okay. There seems to be a challenge. I'd like to put in the last question as we tie down this conversation entirely and also prepare for the conversation we have tomorrow, which is on livelihoods and children living with disabilities. What does the law say on issues gender-based violence, especially when it comes to persons living with disabilities? Are there any gaps experienced currently, and how is the government or civil society involved in tightening these gaps? Of course, a great deal of the issues surrounding this question have been answered during the entire discussion, but I'd like in a final way our panelists to weigh in on the issues that they feel are informing gaps in the law when it comes to persons living with a disability. And I will start with, let me start with, Dan, can you hear me? Dan Matakayia. Dan, are you still with us? Hello, Dan. Okay. Maria Omare.
Yes.
Yes, Maria. So, there's a question I wanted to direct to Julius, but he's a bit, he's having issues with his audio. I want you to help us, even as it's the last question as we tie down this discussion. I want us to weigh in on what the law says on matters gender-based violence and persons living with disabilities and the gaps that are experienced currently in law that are being addressed by government and civil societies. Like, are there any gaps that even in your work as the executive director of Action Foundation that you have found to be wanting, that you feel need to be addressed, gaps in law? Maria.
Thank you, Robin. So, well, Kenya is a signatory to the Convention on the Rights of Persons with Disabilities, and we have our Constitution of Kenya, as well as our Persons with Disabilities Act that was enacted, that all aim to uphold the rights of all of persons with disabilities. And I'd say that one of the things that we are still lagging behind in is access to justice for persons with disabilities, particularly for those who are survivors of GBV. And when it comes to accessing justice, we still have a long way. In fact, we are still in the medieval ages when it comes to access to justice. And I think that that is something that we need to pull together as civil society and different actors to ensure that those who are survivors of GBV, and here we are talking about those, it's mostly for those who have intellectual disabilities. Once they have, unfortunately, when they have gone through an instance of violations and exploitation, getting access to justice is still quite a challenge. I know organizations such as Kenya Association of the Intellectually Handicapped are doing a great work when it comes to advocacy and access to justice. But yeah, a lot of cases go unreported and a lot of perpetrators go scot-free because our justice system is still not designed to support issues of reporting and issues of ensuring that perpetrators are brought to book when it comes to those who have violated the rights of women and girls who have a disability. So I think a lot of effort should go towards access to justice And we need to also bring on board, I'd hope to still hear from Dan, bring on board law enforcement officers, as well as even other paralegals, the judiciary, community health volunteers, to ensure that right from identification of these cases of GBV to reporting at within the law and the different frameworks, we are still able to ensure that the girl truly gets access to justice. So we still have a long way to go, and we hope that conversations such as this can help towards advancing that.
Thank you so much, Maria. I want to ask Dan Matakayia. Dan, can you hear us?
Yes, I can hear you, Robin.
Yes, please chime in even before like I tie that down completely. I'd like to hear your views on these gaps in the law and how you feel, even as a law enforcer yourself, as a trained and working policeman, as a person living with disabilities, as the founder of Dan Shishe Foundation. What gaps do you feel are present in the law? Yes. Can you hear me, Dan? Hello, Dan. Dan. Oh, we lost Dan. Okay. Dan? Okay. Okay. Rhoda, do you feel like you have anything you can add on what Maria has told us, even as we wait for Dan to come back in? I'm told it's being sorted out on his end. Is he back? Dan, are you with us? Dan?
Yes, I'm back. I'm still
Okay.
Yes, bado niko na shida, but I'm back.
Tunakupata kisheria.
Okay.
Tuambie sasa kisheria.
The gaps that I think we still have within our society as we fight the issues of gender-based violence, I think
yes,
even me personally, I've seen is
okay. Okay, this there really is a huge issue with the connectivity, and I really wanted to tie that down with his comment, but regardless, I'm sure we will engage a lot more. I'd like to throw this to you, Rhoda, if there's something you feel you can add. I can see he's trying to connect back. Let us try one last time and see if... Yes, Dan.
Hello, yeah, okay. I was saying...
Just continue, yes.
Oh, there's a problem with... okay. Even when there is to the police, we still have some gaps within the police service.
Okay.
I understand we have gender-based violence, gender desks within police stations, but now the personnel manning the desk, they are not well informed on the issues of...
Okay. Okay. So I believe Dan was trying to inform us on how even within the police force we have gender desks. Ideally, this is the place where you're supposed to get a specialized access to justice when it comes to matters such as gender-based violence, intimate partner abuse, and issues that are heavily correlated to gender. And he was about to explain to us, based on his experience as a police officer, how those desks are handled and what I believe is the situation. Yes, Dan. You are saying
Yeah,
about gender
I was
desks.
saying those personnel manning those desks are not well informed about the issues of
Okay.
violence. We
Okay.
still find that there is a lot of stigma within
Yes.
even the police, because when these individuals goes to report these cases, you know, the
Yes.
way they wanachukuliwa, they are stigmatized in one way or another. So we still have a gap within the police. And then when it goes to the judiciary, the issues of when the courts are giving out cash bail or bond to this to the perpetrators, I feel that they don't consider the victims in this regard, because when this person has accused, has abused the victim, then he or she is charged. Then the following day, anaachiliwa na bond. You know, it renders you like vulnerable, sababu hujui what will happen the next, kesho itafanyika nini, so you feel like your life is even in danger. So there's still a gap whereby we need to engage the judiciary, so that before even giving out the cash bill or releasing this perpetrator on cash bill, the terms of bond terms should be so high.
Despite all the network challenges, we can already see the direction that Dan Matakayia is taking with the conversation. He was in the middle of explaining to us how the process works when it comes to the dispensation of justice, especially when it is surrounded by questions of gender, and how the police force assimilates issues and discussions on gender. I see he's back. Let's. Yes, Dan, just continue from where you left off.
Yeah, so I was saying the bond terms should be quite strict, so that, you know, when a victim of GBV gets justice, it's one way of, it gives him or her a healing and a relieved from the pain. So we are still fighting and engaging these people, the police and the judiciary, to so that these victims wapate justice. What is the other thing? Yeah, I think that's
it.
Yeah, it's still not going.
Okay, thank you so much, Dan Matakayia. That has brought us actually to the tail end of today's discussion. I want to take a few seconds to thank very greatly our panelists. We've had, during the duration of this stream, we've had Mrs. Rhoda Marangu, who is an educationist and a psychologist. We've had Maria Omare, who is the executive director of Action Foundation. It works a lot with persons living with disabilities and children, among a vibrant community of people in the society today. Also within our stream today, we've had Dan Matakayia. Dan Matakayia is a police officer by profession. He is also the founder of Dan Shishia Foundation. In this stream today, we've also had Julius. Julius is a lawyer with Letangule and co-advocates. We've also had our benefactors, Peace Tree Network, represented by Rachel Stephanie, who have made this live stream possible through the work that they do. Peace Tree Network is a vibrant organization that works to build peace in all spheres of the society today. A lot of the work they do is in training, capacity building, so that people know things such as violent extremism, situations like this one, SGBV, violence, intimate partner abuse, and a whole host of things that inform our social tapestry. Also with me today here has been my very able co-moderator, Atieno. Atieno has been helping me moderate the different parts of the discussion. I want to invite you all to a discussion we have tomorrow. Tomorrow we will be talking about livelihoods, children, again, COVID-19, all in the context of persons living with disabilities. So I want to invite you tomorrow at exactly 11:30. We have a very vibrant panel as well. We will also be having live interpretations, just like the one Veronicah is doing right now. Thank you so much, Veronicah, for being with us today. I want to thank all of you for joining in, and I want to invite you all to meet us tomorrow. I will ask all of my panelists to wave goodbye, even as we close this discussion. Thank you so much, and may God bless all of you.